Um, I really wanted to talk to everybody about this uptick in numbers, because I know certainly people are concerned, and I think that that's super appropriate to be concerned. But also, I want to basically frame it for people so that um, I think just creating fear is not obviously helping anybody, and I feel like nobody on the state or national level is promoting any, anything that you can be doing to empower yourself in light of this virus. To me, just telling people to, we have our normal measures of, wearing masks and washing our hands and social or physical distancing, those kind of things. We all know those now, and not going out when we're sick. But I don't feel like there hasn't been a good spin on being able to really, what can you do to improve your health and all of those things. And so as we have already and been doing, I want to continue to focus on empowering people so that people don't feel um, we I just don't want everybody feeling like they're afraid and we got to wait around for another year for a vaccine, because I really think that that is untrue, and I won't choose to believe that. And I mean, obviously, everybody can have their beliefs, but I think there's more that we can do than you know just sit around and wait for a vaccine. Um, so I think people know there were 18 more cases yesterday. There were 5 in the Matsu Valley. I want to say Big Lake had 1. Maybe Wasilla had 4, and Palmer here had 1. More are still coming out of Anchorage. Many of you have heard that there's been positive tests in that Prov transitional care, as well as maybe PEC. So, and they're testing, and so in light of these, and there's Kenai is having some, and there's question, is it related to gatherings, like weddings, those kind of things. And I don't think that they've come out with specific details about it, but that's what's being insinuated. Um, so certainly we're going to see those, but I wanted to show you, I'm down in this testing. We could see the cumulative tests, and one thing that's super important for people to realize, like, look at what is happening with our testing. So, and I thought there was one, that's lab coverage combined, daily test positives. Here we go. This is actually a really cool, this is statewide daily test results. So you can see, like, look at what's happened over time. We are doing more and more tests, more and more results. And so that is going to contribute to, if you will, an uptick in numbers. But when you also look at, if we go, I think if I scroll down here, this is always cool because we can see active cases, recovered cases. The number of deceased has not changed at all. And another really important thing that I want to point out for people, just so we can alleviate fear too, is our current hospitalizations, that number has not shot up. So I think what we're seeing is, with more testing, we're seeing people test positive that have been asymptomatic or pre-symptomatic. And so I think that that's good, and that's worth highlighting. So that's just a spin that I want to put on this, because yes, we still need to be cautious, and we have reopened things, but we will see an increase in numbers, and we're going to continue to see increases in numbers as we do more testing. So to me, that's anticipated. So I just want to alleviate, fears if people have them, as much as I can. Another thing that I wanted to talk about, and this I don't have, maybe I'll actually unshare, since that's not, there we go. I want to see what I can do here. Speaker, there we go. I want to talk a little bit more about the travel mandate. There was a travel mandate that they talked about in yesterday's press conference. And it's, with all the comments and stuff, it's about an hour-long video if people are interested in hearing that. they're talking about prior to coming to Alaska, uh, for us, if we travel out, coming home, those kind of things, we need to be tested either prior to returning or upon our arrival. And they're apparently going to have tests at the airport. These tests will go to the state lab. They were unable to say how many days it's going to take until you get your test results back. So I think there's still some unknowns, but if you come in, apparently, I mean, to me, it sounds a little bit like, for those of you that traveled into a foreign country, you always have to fill out a declaration, or if you've gone to Hawaii, you're bringing something here. So there's some sort of declaration that we're going to have to fill out, and then you either need to present them with this negative PCR test result, so not an antibody test, but a PCR test. You need to be able to present them with that, or you're going to get tested at the airport, or you have to be able to just quarantine for 14 days. For those that show up with a negative test, and I think those that get tested at the airport, it sounds like they're going to also hand out basically a form or a test order, really, so that you can be retested in 7 to 14 days. So they're just encouraging more testing. And I think that, that's going to be helpful to kind of watch what's coming in and out of the state. And for those of us, if we travel out of state, to ensure that we're, that we're not bringing something back. And Dr. Zink in the video yesterday talked about how when we talk about that testing timeline, part of the issue is that we're still dealing with this limitation of some of the testing reagents and those kind of things. So a lot of those things still have not changed, unfortunately. So I think it's good. The idea, I think, is to increase travel, since that is a big portion of our economy, and we travel. And so to allow people to travel, they do want people getting tested. And if you're looking for that mandate, it was the COVID health mandate June 3rd, and it's basically health mandate 10.1. It's international and interstate travel order for self-quarantine. So this was the latest update on that. The other thing I wanted to share, and some of you may have seen, I posted an article on Facebook last week, and it's an article that's been accepted per print. It came out of China, and it talks about food as medicine, and the title is "Food as Medicine: A Possible Preventative Measure Against Coronavirus Disease." And I think it's super cool that we're seeing these things come out. I think we will continue to see them come out more out of foreign countries than our own. That's probably my own internal bias, because I think the drug companies have a stronghold in this country, and we're not going to be doing tests on the nutritional benefits of food here, at least not right now. So the cool thing is if you guys remember some of the things that we have reviewed through the Institute for Functional Medicine in supporting our immune system, some of the key things that they talked about that they were able to show, and they have references, and I will reshare this pre-printed article so that it is part of basically this post Zoom newsletter that I send out. But it talks about onion, garlic, tea, like tea leaves are really helpful. Papaya. We have a harder time maybe finding bitter orange, but turmeric, a lot of us are taking turmeric, and it really talks about immunomodulatory and antiviral capability of these different plants. Figs, soybeans, licorice, and it would be in the Glycyrrhiza glabra is the active ingredient in licorice. It's black licorice. And when people drink tea, those kind of things, and they use the dried roots, that's immunomodulatory. So it's really cool. And when I share this article, when I share a link to it, you'll see way at the back, it's 33 pages in total, but it is, there are, I'll bet there's nearly 10 pages of references on here, so it's not too bad. But there's basically a chart at the end of it, and it goes through each of the different things like mango, black cumin, black pepper, guava, plum, pomegranate, ginger. And so it's really cool. And I think, you know, and maybe I'll put a link back to the blog that I had written that had all of the different immune support articles, talking about stress, talking about sleep, all of those things we can be doing for ourselves. I'll link to those again, just so that people have those as refreshers. And I think, you know, certainly with all of you, I'm still not aware that any one of us, although maybe we've been exposed or not, maybe we've had COVID and we didn't know it, but I'm not aware of anybody that has been sick, which I think is super awesome. And maybe none of us have been tested either. So, you know, that's the hard part. But I think we have had a few tests, but I'm not aware of anybody that's been positive, which I think is really good. One of the articles and links from Functional Medicine that I posted some weeks back was on stress, and I will repost that again, and just want to really reiterate the stress levels that I think a lot of people are feeling right now. In addition to COVID, we've obviously got a lot of unrest, certainly in our nation, in our community. And I just want people just to, you know, do what you can, get outside to mitigate stress, focus on sleep, focus on good nutrition. If you have a safe place you can go, stand barefoot in a yard or a patch of grass or dirt. I think that can be really helpful. And I think now is really a good time for us too, to really focus on things we can control, you know, and so that we can have our own inner peace and sense of calm, because we can contribute that sense to the greater world. And I think that that's helpful. There's definitely, for those of you that are energetically in tune, there's a lot of chaos right now. And I think for all of us, being able to focus on what we can control and our environments. I've been talking to people about, like, you know, working in our yards, working in our homes, helping people get things in order, all of those different things. I think those are really important things that we can do so that we can all create peace around ourselves to the best that we can. And I think, you know, that's my wish for everybody right now, and that we can continue to move through this and move forward, especially with this COVID. And if any of you, you know, have questions or concerns about other things that you can be doing, please reach out to us, because I really want the message out there that there are a lot of things you can do. And I just feel like there's so much fear being spread, and we're being told we have to wait for a vaccine, but then we're being told the vaccine probably might not work anyhow. And I just feel like there's a lot of non-helpful information out there. And like, even listening to some of these updates, I think it's good to be informed, but I have not been dedicating time to tracking these things anymore. Not on a real regular basis. I do from a medical standpoint, and I'm always looking for positive things for us. But just to watch numbers, like, I just don't feel like it's helpful to me right now, and I don't need more stress in my day. It's kind of like for people watching the news. I don't watch the news in general, because I don't think. Usually I'm not learning something super helpful from that, and it seems to contribute to stress. There's one more thing about COVID that I will share a link to as well. One of my colleagues on the East Coast, Kara Fitzgerald, she is a functional medicine provider and a naturopath. she has highlighted a little article that has two recent papers in it. One is a preprint paper, one is in the journal Cell. And the cool thing is it sounds like they're seeing some studies now that there's some cross-reactivity. And what that would mean is that our exposure in the past to some of these cold-causing coronaviruses may be actually giving us some cross-reactive immunity. And I think that that's really positive. The other study has come out of the Charity University Hospital in Berlin, and they're seeing something similar. And these are two small studies, but I think that that's more positive data as well, which I think is important to share and to help, again, alleviate some of the fears and concerns that people have. So that's kind of all I've got this week for all of those things. I do want to mention we did get more Virusid in finally. We have zinc in the office as well. And then on June 11th, I'm going to talk about brain health, dementia, and Alzheimer's. So that probably be a little bit longer talk, again at 9:30. The 18th, we will not have a talk. And then on the 25th, we will have another one of these Zoom visits. And at that time, I'm going to talk a bit about men's health, because I think a lot of times we spend a lot of time on women's health, so we'll talk about men's health then. And then I'm going to try in the next couple of weeks here to put together what we can talk about in June. And I've been focusing a bit on, what is, this month is Alzheimer's month, it's Men's Health Month, and it's Safety Month. And I was going to try to figure out what to talk about in terms of safety, and I'm not even sure where to go from there right now, whether it's keeping yourself safe when you're out traveling in the world versus bicycle safety. I certainly know a fair bit about, and there's a multitude of things. And so if somebody's dying to hear something about a topic, let me know what that topic is and I can look into it. But I think focusing a bit on men's health and Alzheimer's and dementia will be really helpful really for all of us. And then I'll figure out what we're going to talk about in July as well. So if maybe what I'll do is have Gina send out another one of those Google forms for topics that people have. I think we've hit a lot of the topics people asked about. And that will be something else that I can do too, because I certainly want input from you guys, like what you want to learn about. That will help me focus on something, because I can pick lots of random things, but if there is something specific, I would really like to address some of those things. So if you come into the office, if you've not gotten your neck gaiter yet, I don't have mine on today. We have them here, so please give a shout. You can come pick up a neck gaiter. We've got them for all the members. And then you'll notice when you come in, we're staggering appointments right now so that we can clean the room and doing all those things. We're asking that you wear a mask of sorts here. I am wearing a surgical mask. Gina's generally wearing a cloth mask. Salita's wearing a surgical mask when she's interfacing with you as well. And the other thing that you guys might notice, I think you'll notice, because right when you walk in to go back to the exam room, is I have an air reactor on the floor. So you'll hear it a little bit. It's just I don't know, it's not an innocuous sound, but basically what this air reactor is doing, it's a combination of filter and light, and we leave it running 24/7. And theoretically what it is doing is, number one, it's purifying our air, but this also has been shown to filter down to the level of even viruses and stuff. So theoretically, coming in here, the air is it's significantly cleaner, and people may or may not notice it. We have noticed it in a big difference since we've had it running, and we've had it running since kind of mid-March, I think, in the office. And it's certainly helped those of us with any allergies. Like if we go outside, as long as we're in here, we seem to be doing really well, and it's taking stuff out of the air. And so that's another thing you'll see, that I just thought it was, this was a good opportunity to try it. And the timing was right to try it. So we are, and we're really happy with it. And so we're going to keep that running. So when you walk in and you see a little metal box, that's what that is. But otherwise, things are normal here. We're still doing some telemedicine as much as possible. But if you need to be seen here, we will get you seen here as well. The testing sites in the Valley still are the same. So if people are sick, Capstone has testing, the hospital has testing, urgent care off of Bogard and Cruzy has testing as well. And hopefully everybody is staying safe and enjoying this weather. You know, get outside if you can, and just be out in nature. And we're lucky we've got a lot of space and a lot of beautiful places here so that we can enjoy that. So any questions for anybody? I haven't seen anything pop up in our chat box here. If not, awesome, thank you. I do really appreciate you guys tuning in. I hope that this time works. We'll put that, we will definitely put the, lost my train of thought. I'll post the articles for here, and then actually I was going to say that I did figure out my train of thought. I will we'll send out that that Google form again so that people can give us some ideas, and I just want to make sure that I'm addressing concerns, and you know, please reach out if there are questions, concerns about things, if there's things that you want me to address. Without like getting myself stressed, I am staying on top of this. So I don't want you to think that I'm not staying on top of it. I am. I'm just not watching all of these things because a lot of the questions are frankly driving me crazy, because I think people sometimes aren't thinking for the greater good and thinking about people outside of themselves. And so I am staying abreast of this, but I'm really focused, which you all know, I'm focused on things we can do, and all those things that we can do to help ourselves, especially to get through times like these. And we've got some rough times ahead for ourselves, our community, our nation, and COVID. But we'll get through these things, and we'll come out, I think, better on the other side of it. So, and I'm pretty confident that that will be the case. So.